PA oblique and lateral projection of the digits of the hand is performed with the patient seated at the end of the table. A lead shield should be placed on the patient's lap for radiation protection. The height of the table should be adjusted so the patient's forearm rests easily on the table. An 8x10 image receptor is divided by lead blockers into 3 sections. The PA projection is performed by placing the palmar surface of the digit on the surface of an unmasked 1/3 8x10 image receptor. Collimation improves radiographic contrast. The central ray is directed to the proximal interphalangeal joint, or PIP. When making the exposure, the patient should remain very still, but suspended respiration is unnecessary. A PA digit radiograph should demonstrate all skeletal anatomy from the fingertip to the distal portion of the adjoining metacarpal. Equal concavity of the phalangeal shaft, surrounding soft tissue, and fingernail should be well visualized. The oblique projection begins by resting the protonated hand on the second unmasked portion of the IR. Rotate the hand externally or internally until the digits is separated and rotated 45 degrees. Collimation improves radiographic contrast. The central ray is directed to the proximal interphalangeal joint. The PA oblique radiograph of the digit should demonstrate the entire digit rotated at a 45-degree angle with unequal concavity. The lateral projection of the 2nd through 5th digit begins with the patient extending the digit in question and closing the rest of the digits into a fist secured by the thumb. Rest the patient's hand on the lateral or radial surface of the 3rd unmasked side of the IR. The patient's hand is rested on the medial or ulnar surface for the 4th through 5th digit. Collimation improves radial contrast. The central ray is directed to the proximal interphalangeal joint. The lateral digit radiograph should demonstrate the entire digit with unilateral concave anterior surface of the phalanx and the fingernail in profile. Appropriate contrast density will demonstrate it with both soft tissue and tubercular of the bone.